So, good morning, everyone. So, we are the group three, and we're going to talk about the infectious disease in the Philippines. So, first, I am Ralph Victor Gamboa, and my group mates are Mr. Archie De La Cruz, Miss Janeline De La Cruz, Miss Julie May Tablada, and Mr. Robert Gulan. So, first, water or foodborne disease. So, what is water or foodborne diseases? So, food and waterborne illness, often referred to as food poisoning. It is generally caused by eating or drinking food or beverage contaminated by bacteria, parasites, or viruses. These organisms are passed in the feces of animals and infected people. So, let's talk about the first disease. It is called the typhoid fever, also called enteric fever or mas kilala bilang enteric fever, na nagkakos ng isang bakterya at ang bakterya ay nagngangalang Salmonella. Typhoid fever is rare in place where few people carry the bacteria. It also rare where water is treated to kill germs and where human waste disposal is managed. So for the symptoms include the high fever, pananakit ng ulo, pananakit ng chan or stomach pain, and the constipation or diarrhea. Next. So as you can see in the picture, the typhoid fever is meron siyang salmonella typhi. And the white coating on the tongue, and then the ulcer in the intestine. And meron din pong rash on the body at enlarged liver and spleen. Next. Typhoid sign and symptoms. The common symptoms including the fever, the headache or the muscle ache, the stomach pain, rash made up of small pink spots on any part of the body. So, tapos next is the causes. A bacteria strain called Salmonella enterica stereotype type causes typhoid fever. The typhoid carriers, even after antibiotic treatments, a small numbers of people who recover from typhoid fever still have the bacteria living in their bodies. So for the risk factors are travelers, work in or travel to areas, work as a clinical microbiologist, or the close contact with someone who is infected. Next. So the complications po. First is the damage to intestines. The other possible complications including the myocarditis. So what is myocarditis? Myocarditis is inflammation of your heart muscle or nagngangalang myocardium. This can be weaken your heart muscle and making it more difficult for your heart to pump. This is rare condition can affect people quickly or slow over time. The second possible complication is pancreatitis. Pancreatitis is a redness and swelling, inflammation of the pancreas. It may be sudden or a chronic. The most common are the most common causes are alcohol abuse and lumps of solid material gallstone in the gallbladder. The goal for treatment is to rest the pancreas and let it heal. So the third possible complications are kidney or bladder infections. A kidney infection is a type of urinary tract infections. Kidney infections may begin in the tube that carries urine from the body, urethra, or in the bladder. The infection can travel to one or both kidneys. A kidneys infection is also called pyelonephritis. The fourth one complications is pneumonia. So pneumonia is a form of an acute respiratory infection that affects the lungs. The lungs are made up of small sacs called alveoli, which fill with air when a healthy person breathes. When an individual has pneumonia, the alveoli are filled with pus and fluid, which makes breathing painful and limits oxygen intake. The last second one is the endocarditis. So endocarditis is inflammation of the inside lining of the chambers and the heart valves. It is caused by a bacteria or rarely a fungal infection. The last one is aneurysm. An aneurysm is an abdominal swelling or bulge in the wall of a blood vessel such as an artery. Aneurysm can occur anywhere throughout the circulatory system, but mostly develop along the aorta, the body main artery that runs the length of the trunk, and in the blood vessels of the brain. The prevention vaccines. There are two vaccines available in the United States for the people aged 2 and older. One is given as a single shot at least 1 week before travel. The second one is given orally in 4 capsules, with one capsule to be taken every other day. Next. The second disease is called hepatitis. It is an inflammation of the liver. The condition can be self-limiting or can be progressed to fibrous scarring. Cirrhosis or liver cancer. Hepatitis viruses are the most common of hepatitis in the world. But other infections, toxic substances, example alcohol, certain drugs, and autoimmune disease can also cause hepatitis. Next. So there are five main viral classifications of hepatitis. The hepatitis A, B, C, D, and A. So let's talk about the hepatitis A virus. In the present in the feces of infected person, it is the most often transmitted through consumption of contaminated water or food. Hepatitis B virus is transmitted through exposure to infected blood, semen, and other body fluids. Hepatitis B can be transmitted from infected mothers to infants at the time of birth or from a family member to infant in early childhood. Hepatitis C virus is common transmitted through exposure of infected blood. This may happen through transfusion of hepatitis C virus, contaminated blood and blood products, contaminated injections during medical procedures, and through injections drug use. Hepatitis D virus. Infections occur only in those who are infected with hepatitis B virus. The dual infections of hepatitis D virus and hepatitis B virus can result in a more serious disease and worse in outcome. Hepatitis B vaccine provide protection from hepatitis B infections. The last one is hepatitis A virus. Is commonly transmitted through consumption of contaminated water or food. Hepatitis E virus is a common cause of hepatitis outbreaks in developing parts of the world, and is increasingly recognized as an important cause of disease in developed countries. Next. So the types of hepatitis, including the transmission, the prevention, and the treatment. The first one is hepatitis A. For the transmission, it is caused by eating contaminated food or drinking contaminated water. The prevention, practice good hygiene and syempre vaccines. So for the treatment, there are no treatment for hepatitis A. Hepatitis B. The transmission through contact with the blood or bodily fluids of an infected person. The prevention is also called practicing good hygiene, also vaccine and blood screening. For the treatment is alpha interferon. So what is alpha interferon? Alpha interferon is a cytokine produced by the innate immune system as a response to the environmental exposure, including the viral infections. Alpha interferon in various formulation has been developed as therapy of several forms of cancer and viral infections, but its major use has been as a therapy for chronic hepatitis B. Pigeon interferon. So pigeon interferon is sold under the brand names Pegasus, among others. The medication used to treat hepatitis B and hepatitis C. For the hepatitis C, the transmission is blood-to-blood contact. The prevention is practicing good hygiene, avoid sharing needles, toothbrushes, razors, or nail scissors. The treatment is direct acting antiviral drugs. Hepatitis B. The transmission is contact with infected blood only occurs in the people already infected with hepatitis B. The prevention is hepatitis B vaccines and avoid sharing needles, toothbrushes, razors, and nail scissors. Further treatment is interferon. So, what is interferon? Interferon is a natural substance that helps the body immune system fight infection and other diseases such as cancer. Interferons are made in the body by white blood cells and other cells, but they can also be made in the laboratory used as a treatment for different diseases. The last one is hepatitis E. The transmission is eating contaminated food or drinking contaminated water. The prevention is practicing good hygiene and avoid drinking water that has come from a potentially unsafe source. So for the treatment, there are no treatment for hepatitis E. Next. The causes of hepatitis. Hepatitis A. The common route of transmission is exposure to hepatitis A virus in food or water. The second one is hepatitis B. The common route of transmission is contact with hepatitis B virus in the body fluid, such as blood, vaginal secretions, or semen. Hepatitis C. The common route of transmission is contact with hepatitis C virus in the body fluids, such as blood, vaginal secretion, and semen. Hepatitis D. The route of transmission is contact with blood containing hepatitis B virus. The last one is hepatitis. The route of transmission is exposure to hepatitis A virus in food or water.
Next is the cholera. It's an acute diarrheal infection caused by ingestion of food or water contaminated with the bacterium Vibrio cholerae. Cholera remains a global threat to public and an indicator of inequity and lack of social development. History. During 19th century, cholera is spread across the world from its original reservoir in the Ganges Delta in India. Six subsequent pandemics killed millions of people across all continents. The current seventh pandemic started in South Asia in 1961, reached Africa in 1971, and the Americas in 1991. Cholera is now an endemic in many countries. Next. Cholera is an infection of the small intestine. It is spread mostly by unsafe water and unsafe food that has been contaminated with human feces containing the bacteria. Common symptoms: watery diarrhea, nausea and vomiting, dehydration. Severe symptoms: muscle cramps, rapid heart rate, blood pressure, low blood pressure, persistent vomiting. Next. Next. The treatment: the oral intake of packed water containing balanced mineral salts and glucose. Oral dehydration therapy. Next is the intravenous drip, feed into a vein. and antibiotic tetracycline and chloramphenicol destroy fibers and decrease diarrhea. Ikaw na, Kuya Rob.
Sa akin naman, amoebic dysentery, also known as amoebiasis. Amoebic dysentery is an intestinal inflammation, especially in the colon, that can lead to severe diarrhea with mucus or blood in the feces. Causes: you get amoebiasis when a parasite called Entamoeba histolytica enters your digestive system, found in contaminated foods and drinks. Epidemiologic background: commonly found in less developing countries. Travelers to countries with poor sanitation are the greater risk of contracting the disease. It can affect anyone, young or old, of either sex. Risk factors: alcohol, older or younger age, use of corticosteroid medication to suppress the immune system, cancer, pregnancy, malnutrition, recent travel to a tropical region. Excuse me. Signs and symptoms. Mild symptoms. First one is cramping or abdominal pain, diarrhea sometimes with rectal bleeding, fatigue, excessive gas, rectal pain while having a bowel movement, unintentional weight loss. Severe symptoms: abdominal tenderness, bloody stools, fever, and vomiting. Prevention. You can reduce your risk of amoebiasis infection by being careful about what you eat and drink when traveling to areas with poor sanitation. You should avoid eating raw fruits and vegetables. Peel and wash produce before cooking. Avoid drinks with ice cubes. Drink only sealed bottled water or boil water before you drink it if bottled water is unavailable. Wash your hands frequently with soap and water after using the toilet or changing a baby's diaper. Sa akin pa rin ba to? Sa akin pa rin, no?
Kila Kuya Archie.
Ate Jen?
E. coli diarrheal yeast. It is a bacteria that commonly lives in the intestines of both healthy people and animals. In most cases, this bacteria is harmless. It helps digest the food you eat. However, certain strains of E. coli can cause symptoms including diarrhea, stomach pain, and cramps and low-grade fever. Some E. coli infections can be dangerous. Ito yung mga saan nakukuha yung E. coli natin? From contaminated food or drinks. Ayan, nagko-cause siya ng stomach ache, then diarrhea. Then, minsan nakakamatay din po siya pag hindi naagapan. Blood in the, after diarrhea, minsan nagkakaroon ng blood in the stool, then nagsusuka yung isang infected person. Yan, nilalagnat. minsan may hemolytic condition 'no, 'pag hindi naagapan, eventually namamatay yung isang pasyente. Next. These are the risk factors. Age. Young children and older adults are higher risk of experiencing illness caused by E. coli and more serious complications from the infection. So, common yung mga bata at saka mga adults natin. Kasi mahina pa yung mga tiyan nila sa madali lang silang mapasukan ng mga infections. Weakened immune system, so yung mga may hina immune system. People who have weakened immune systems from AIDS or from drugs to treat cancer or prevent the rejection of organ transplant are more likely to become ill from ingesting E. coli. So yung mga yun, yung mga mababang immune system na mga tao. Pag madali lang silang ma-infect. Eating certain types of food. These canned foods include undercooked hamburger and unpasteurized milk, apple juice or cider, and soft cheeses made from raw milk. Time of year, though it's not clear why the majority of E. coli infections in the US occur from June through September. So, yun nga, yung mga time kasi na yan, tag-ulan. So, mas maraming cases ng E. coli. Decreased stomach acid levels. Stomach acid offers some protection against E. coli if you take medication to reduce stomach acid, such as esomeprazole, pantoprazole, lansoprazole, and omeprazole. Increase your risk of an E. coli infection. Yes. Next. Contaminated water. Human animal stool may pollute ground and surface water, including streams, rivers, lakes, and waters used to irrigate crops. Although public water systems use chlorine, ultraviolet light, or ozone to kill E. coli, some E. coli outbreaks have been linked to contaminated municipal water supplies. So, doon po nakukuha din minsan yung mga contaminated water. Personal contact. E. coli bacteria can easily travel from person to person, especially when infected adults and children don't wash their hands properly. So, yan. Family members of young children with E. coli infection are especially likely to get it themselves. Outbreaks have occurred among children visiting petting zoos in animal barns of Filipinos. Next. Prevention. No vaccine or medication can protect you from E. coli-based illness, though researchers are investigating potential vaccines. To reduce your chance of being exposed to E. coli, avoid swallowing water from lakes or pools. Wash your hands often. Avoid risky foods and watch out for cross-contamination. So, na-encourage natin yung mga lahat, hindi lang mga bata, to wash hands talaga bago kumain ng anything para ma-prevent yung mga E. coli infections.
Sir RG, nakamute to.
Bacillary dysentery. Bacillary dysentery is a gastrointestinal disease. Bacillary means related to bacteria, and dysentery is severe diarrhea containing blood or mucus. So, These are the causes of the bacillary. The bacterial infection that can be lead to bacillary is dysentery, are very contagious. The bacteria are usually passed from person to person, from fecal matter or yung poop from an infected person gets into another person mouth. This can occur during, okay? Okay? Food preparation by someone with poor hygiene. The ingestion of contaminated water, the sexual contact, especially involving the anus. Yan. Season, body. Sira niya na, magsara na kayo. May pasok ako. Hindi na ako makakapagbalik. Some of the most common bacteria that lead to bacillary dysentery are Shigella, which leads to sigeliosis, Salmonella, which causes Salmonella poisoning, the Campylobacter, which causes Campylobacteriosis, Escherichia coli, leading to E. coli infection. Okay. These are the causes of the bacillary. So bacterial causes sa mga person-to-person and body infections. Madali lang siyang kumalat. Wala siyang pinagkaiba sa E. coli. Same, same din ang mga next tayo is the symptoms of bacillary dysentery range from mild to severe, including the diarrhea containing blood or mucus, the high fever, the painful stomach cramps, nausea, and vomiting. Yan talaga yung mga cause talaga ng bacteria yan. Pag nilagnat ka na, nagkaroon ka ng sakit sa tiyan. Sususo ka, yan, mahihilo. Okay? Next tayo. Next for the symptoms. The sigeliosis bacillary dysentery. The pathogens, the Shigella SPP, the symptoms 20 pm per day or your bowel movement per day. Diarrhea is often bloody cramps, fever. The intoxication, yan, the infection, endotoxin, and Shiga, exotoxin. The diagnosis, as isolation of bacteria. The treatment, oral rehydration, fluoroquinolones. Next tayo. And the treatment, dito meron namang mga treatment sa sakit na yan. Many people with bacillary dysentery don't need medical treatment. The symptoms often get better in a few days to a week. Those people should. Ito, avoid anti-diarrhea medications. Sabi nga namin, ang mga nababasa natin, ayaw nyo lang lumabas yung mga yan. Kasi pag napipigilan sa katawan natin, is mapapasama. Drink plenty of fluids to prevent dehydrations, common with diarrhea, para hindi tayo ma-dehydrate. Isolate themselves from other people for at least 2 full days after the last episodes of diarrhea. Take over-the-counter medications to reduce pain and fever. At kung hindi naman kaya ang mag-self-medicate at talagang tuloy-tuloy pa rin ang pagtatae, punta na tayo sa pinakamalapit na emergency hospital para malap matapatan tayo o mabigyan tayo ng agarang lunas para hindi tayo lalong mapahamak. Lalong-lalo kung tuloy-tuloy ng ating pagdudumi. Okay? Next tayo sa slide. The prevention again, don't share personal items with other people, such as towels. Don't use water unless you are sure it's sterile, free of germs. Strategies include boiling water and use chlorine tablets or using bottled water. This includes water for drinking, cooking, and brushing your teeth, as well as for eyes. Stay away from other people who are ill. Thoroughly cook all food. Wash all fresh fruits or vegetables with clean water or pill before eating. Nung unang panahon kasi itong dysentery o dysenterya, talagang sakit ito na magdaling kumalat. Bakit? Kasi noon, balon lang naman ang ating mga pinag-iinuman. Di ba? Balon. Tapos sa ilog, mga bukal. Hindi natin alam yung mga, hindi pa alam ng mga ninuno natin ang ganyang klase na nung meron ng mga LGUs, ng mga DOH, sila na ang nagsasabi na pakuluan ng tubig or uminom tayo ng sterile water para malinis ang ating mga inumin. So ngayon, konti lang naman ang meron ganyang mga sakit, kaya kayang-kaya natin i-prevent. Isang Google lang, malalaman mo paano natin makikita kung ano yung mga gamot or i-prevent sa sakit na yan. Okay? So with that, thank you very much for your listening. And agyaman na kuray, yaklam sa tiragsak. Na yung pagnirabi, yo amin awan labas.
Yes.